learn. This is a very basic thing which we learn in our graduation also. It is not important that you need to be a prosthodontist to know this answer. Do we have any reply, Dr. Sophia?
No, Dr. Sanjana, nothing yet.
Okay, so now I'll just move forward to the next part, that is a different types of Facebow. So it's just a photograph which shows how we record. Like this, as you can see, this is parallel, but it is not important that every time this relationship is parallel. If there is a cant, you cannot make it parallel. You have to record the exact relationship of maxilla to the TMJ. Now there is two different types of Facebows. One is arbitrary and one is kinematic. Now arbitrary, by the names itself says that is arbitrary, not the exact location. So for example, this is the true hinge axis of the patient where we are recording. So arbitrary Facebow is which gives a discrepancies of 0.5 mm, which is manageable. So arbitrary is easy to use, give a discrepancy of 0.5 mm, but then also we can use arbitrary Facebow. Now, arbitrary Facebow is mainly recommended for complete denture patients. The next type is kinematic Facebow. Now, kinematic Facebow gives you the adequate, accurate true hinge axis. So that's why it is recommended for full mouth rehabilitations or full mouth implant cases. But it is little complex things. So that's why we need to understand the kinematic Facebow also. But it's not necessary that you cannot use arbitrary for full mouth, because it's not easy to understand kinematic unless you do the practice. So this is a kinematic Facebow where there is a stylus given which records the mandibular movements of the patient, that is lateral and protrusive. What we say, right lateral, left lateral and protrusive. These records are given in the graph, and based on that we do the occlusion of the patient. That is the kinematic Facebow. Next comes the importance of Facebow